Local nurses are headed to North Carolina to help in the aftermath of Hurricane Florence. The state health department is sending more than 30 to help at shelters, 9 of which are from Hampton Roads and the Eastern Shore. And joining me from the agency to talk about the effort is Larry Hill. Thank you for taking some time.
My pleasure.
You know, it seems like everybody is affected by this. You know, people know relatives, and you were just telling me about your relatives.
Correct.
Down there. They're okay?
My relatives are okay, but yes, they've had some damage and issues with the floods as well.
Yeah, it's just amazing. And now you have this group going down. What exactly will they be able to help with?
Well, we already have some down there, and I know for a matter of fact today we've added 2 more. They're working in the shelters. I know today a couple of them went over to Wilmington, working in shelters in Wilmington, and others in New Bern. So communications is difficult. Of course, you know, everybody's using cell phones and stuff, so we're having some hard time talking to them.
Right.
But they're going to see things, and they're going to be able to provide services like the routine things, check on people's blood pressure and you know, temperatures and stuff. You know, people get in there, sometimes they're sick and then things spread. So they're going to be monitoring all those types of issues. But one of the most important things is a lot of those nurses that we have now have what they call psychological first aid training. The stress that's building up for the people in the shelters, a lot of them have been there for over a week now. They're going to be monitoring things such as the stress levels and where if they're having any mental health issues, and helping with referrals if that happens. That
is so important to have that. You don't really think about that, but you know, I was reading where a lot of the people coming into the shelters they have different types of infections because of the contaminated water. Correct.
We saw it during Katrina when I was working at a shelter during that time. So I think with the contaminated water. Also, believe it or not, there are a lot of dental issues that come out of these, and we have to find services for folks like that.
Now, did the people who from your agency, some of them just volunteer to go, or
all the ones that went volunteered to go? They should be down there for about 2 weeks before they get to come back.
Okay. All right. And they'll have some stories to tell, I'm sure.
They will. They've already started taking pictures and telling stories.
Well, I appreciate you telling us about it, and thank you to them for taking the time to go down there.
I will tell them.
Yeah. All right.